Hello, and thank you for reviewing this information about Medisys, its people, the services offered, and its many benefits to nurses and the hospitals and other organizations that employ them. Perhaps the best way to explain the professionalism at Medisys and the company's understanding of the industry is simply to point out that it is fully immersed in the industry.
It is a nurse-owned and operated company, and we have nurses dealing and talking with nurses. Often the managers that we deal with are nurses on our client side, as well as the nurses that we recruit. Our nurses have often done the type of work that they're interviewing the person for. Most of them have experience in utilization and case management and some type of medical record review. And in addition to that, we provide a personalized service, pay attention to all the details. Professionalism is very important to us, as well as the quality of service that we provide to our customers.
That's Medisys founder and president Kim Ebersol. She explains that she first realized the need for the services her firm now provides when she was out in the field herself.
At the time, I was working for an insurer doing utilization and quality management. And as a part of that job function, we went out to different hospitals. What we were observing was how short-staffed they were, how difficult it was to keep up with the current regulations pertaining to utilization review, and how nice it would be to be able to have someone experienced come in and help them out.
Medisys fills that bill perfectly, says Kathy McCarran of Client Health Partners, where she is Director of Quality Management and Disease Management and the Baby Partners Program.
They're small enough that they really understand the business needs of me, their customer, and they also have a great relationship with the nurses that work there. They speak glowingly of the mentoring, the coaching, and the exposure that Medisys gives them. So I think that's important for me as a nurse, and I think it's important because they really fit the customer with the nurse that will do the job.
Lots of effort goes into matching nurses with clients. Nancy Sullivan, who works within Medisys as well as serving as one of its contract nurses available for temporary hire, says there is a rigorous screening of all potential candidates.
They ask that prior to your interview, send an updated resume, and then you come in and have an interview where the recruiters really delve into your experiences, your skills, abilities, what your interests are, and all that is put into a database. They look into your licensure, your certifications.
Sullivan says Medisys also looks into references, background checks, and drug screening as required by most employers. Meanwhile, nurse candidates also get help with coaching for job interviews and preparing resumes. And she loves the diversity of opportunities.
Personal experience, I have done work for both the health plans and also for the large hospital systems. I have functioned in utilization, case management, pre-cert, claims, project work, including HEDIS and credentialing for health plans.
Medisys also connects employers to personnel qualified in medical legal review, workman's comp, discharge planning, quality management, and other specialties. Kathy McCarran at Health Partners says she finds the availability of nurses fluent in HEDIS medical record review particularly helpful.
We do it on a regular basis, and I've used the Medisys nurses here as well as in my past, and Medisys has such a good handle as an organization on the process that their nurses are very prepared to hit the ground running.
All work assignments are specifically selected to match a nurse's skill level and availability. But with so many areas to serve, Medisys helps fill any gaps in supply by providing training and educational programs, including courses in understanding HEDIS, observation criteria, appeals, and utilization management. Follow-through is also a key ingredient in the Medisys recipe, with continued support to client managers and the nurses who are placed. And if there is a problem, Kathy McCarran says, Medisys is right there.
I did have a concern with one of the nurses, and I called Medisys right away. They addressed it immediately. They interceded on my behalf to the nurse and cleared up the situation. That, to me, is huge because they understand that they want to keep me happy, and they understand that I am under a tight time frame, and so I need professionals that were really going to get the job done.
Based in suburban Philadelphia, Medisys currently serves a wide range of clients throughout the northeastern U.S., from community hospitals and tertiary care centers to insurance companies and law firms, and offers a broad choice of nurses for everything from temporary part-time to permanent full-time positions. Prompt invoicing and payroll processing are also part of this picture. Contact Medisys today at 888-275-9598. I'm Bill Fantini. Here's to your health.